Ladies and gentlemen, today I am here to talk about a topic that perhaps all of us will face at some point in our lives: the signs that our loved ones are in their final years. This is not an easy topic to discuss, but it is extremely important because early recognition can help us provide better care, prepare mentally, and bring the most peaceful moments to our loved ones. As the elderly enter their final days, their bodies and minds will undergo certain changes. Below are 5 subtle signs that we should not ignore. First, obvious physical decline. Obvious physical decline is a worrying sign, often seen in the elderly, patients with chronic diseases, or in the final stages of serious illness. The body gradually weakens, weight loss is significant, and energy is exhausted, making them unable to take care of themselves. Simple activities such as walking, eating, or even sitting up become difficult. The cause of this condition can be due to chronic diseases such as end-stage cancer, heart failure, kidney failure, Parkinson's, Alzheimer's, or chronic obstructive pulmonary disease, COPD. Malnutrition is also an important factor when the body does not receive enough nutrients, causing muscles to atrophy and reduced mobility. In addition, metabolic disorders such as uncontrolled diabetes, hyperthyroidism, or hypothyroidism can also weaken the body, while the side effects of some drugs such as chemotherapy, steroids, or opioids can make the patient exhausted. Important signs to watch for include rapid weight loss, loss of muscle mass, persistent fatigue, loss of appetite, indigestion, cognitive decline, disorientation, and difficulty moving. When the physical condition is weakened, the patient's psychology is also severely affected. They are prone to depression, anxiety, and feel helpless when having to depend on others for daily activities. Feelings of loneliness and abandonment can exacerbate decline. To support those who are physically declining, a balanced diet rich in protein, vitamins, and minerals is needed to maintain muscle mass and energy. Physical therapy can help improve mobility and reduce pain, while emotional care plays an important role in helping them feel cared for and have meaning in life. The use of assistive devices such as lift chairs, wheelchairs, or specialized hospital beds can also help them move more easily. If your loved one is experiencing this condition, close monitoring and timely medical support are essential to improve quality of life and prolong healthy life. Second, changes in sleep and alertness. Unusual changes in sleep and alertness in the elderly or seriously ill can be an important warning sign. They may sleep more than usual, have difficulty waking up in the morning, feel disoriented, and lose track of time and place. Sometimes they are alert at night but confused during the day. This is not just part of the aging process, but can be a sign that the body is preparing for death. The cause of this condition may stem from a decline in neurological function, when the brain no longer functions as efficiently as before, leading to a disruption of the biological rhythm. Lack of oxygen to the brain due to heart failure, respiratory failure, or stroke can also cause drowsiness, disorientation, and cognitive decline. When the liver and kidneys function poorly, toxins accumulate in the body, affecting the brain, causing the patient to fall into a state of drowsiness, lethargy, or impaired alertness. In addition, in the final stages of many diseases, the body consumes less energy, the need for sleep increases because it is no longer able to maintain the same level of alertness as before. Some patients also experience sleep disorders due to sleep apnea syndrome, insomnia due to pain or side effects of sedatives. The most obvious signs are sleeping too much, less responsive to the surrounding environment, difficulty waking up in the morning, disorientation about time and space. They may be unusually alert at night but confused during the day, even having moments of daydreaming, talking nonsense, or seeing hallucinations due to the brain's reduced ability to process information. These changes greatly affect the quality of life, causing the patient to fall into a state of anxiety, fear, loss of behavioral control, sometimes having nightmares, paranoia, or feeling isolated. Relatives may be confused when witnessing the patient's erratic changes, especially when they have periods of alertness alternating with drowsiness, loss of awareness. To support the patient, it is necessary to establish a comfortable sleeping environment, keep the bedroom quiet, cool, limit light and noise at night to make sleep more natural. Maintain a stable daily schedule, limit excessive daytime sleep to improve nighttime sleep. If this condition is related to diseases such as heart failure, respiratory failure, or neurological disorders, active treatment is needed to help the patient improve overall health. At the same time, emotional support is very important. Talking gently and maintaining the presence of loved ones will help them not feel confused when they wake up. In serious cases, you should consult a doctor to assess the cause and have appropriate intervention. Changes in sleep and alertness are important signs that should not be ignored, especially when accompanied by other signs of physical decline. If your loved one is experiencing this condition, monitor closely and seek timely medical support to help them have a gentle and comfortable end-of-life journey. Third, decreased appetite and poor digestion. When an elderly person or a patient with a chronic illness gradually loses their appetite, eats only a small amount, or even refuses to eat, it is not simply a normal loss of appetite but can be a warning sign that the digestive system is declining. This is an important manifestation in the body's exhaustion process and can be related to many physiological and pathological causes. The cause of this condition can come from the decline in digestive function when the stomach and intestines slow down, reducing the rate of digestion and absorption of nutrients, causing bloating, indigestion, and making the patient no longer want to eat. Energy metabolism disorders in the late stages of the disease cause the body to consume less energy, reducing the need for food intake. Impaired liver and kidney function causes toxins to accumulate in the body, causing nausea, fatigue, and loss of appetite. Fluid accumulation and intestinal motility disorders due to heart failure, cirrhosis, or kidney failure put pressure on the stomach and intestines, causing the patient to eat very little. Some medications such as opioids, antidepressants, or chemotherapy can also cause nausea, change the sense of taste, and cause loss of appetite. In addition, psychological factors such as depression, anxiety, or feelings of boredom can also make the patient lose interest in eating. Obvious signs of this condition include prolonged anorexia. The patient does not feel hungry even when not eating anything, rapid weight loss due to insufficient energy intake, bloating, indigestion after eating a small amount, nausea or vomiting, especially after eating foods rich in fat or protein, loss of taste or change in taste, feeling food is bland, unpleasant. Decreased appetite and poor digestion not only cause the body to lack nutrition but also accelerate the process of exhaustion. When there is not enough energy and nutrients, the immune system is weakened, increasing the risk of infection and disease. Muscles also gradually atrophy, causing patients to lose the ability to move and become completely dependent on others. At the same time, their psychology is also affected, feeling tired, depressed, losing joy in life. To support the patient, the diet can be adjusted by dividing meals into several times a day, prioritizing foods that are easy to digest, rich in protein and energy such as soup, porridge, milk. Use natural spices such as ginger, lemon, or mint to stimulate the taste buds. If the patient cannot eat enough orally, consider supplementing nutrition through a nasogastric tube or intravenous infusion under the guidance of a doctor. Creating a comfortable dining space, a warm, quiet, pressure-free environment can help the patient feel more comfortable when eating. At the same time, provide psychological support by talking and encouraging them to reduce stress and help them have the motivation to maintain eating. When you notice that your loved one has signs of decreased appetite and poor digestion, you need to monitor closely and seek timely medical support. This can be an important sign that the body is seriously weakened, and appropriate interventions are needed to ensure that they receive the best care during this period. Fourth, psychological and emotional changes. When an elderly or seriously ill person enters the final stage of life, psychological and emotional changes can become obvious. They may become quiet, less communicative, withdraw into their inner world, or, on the contrary, suddenly want to talk more, reminisce about the past. Some people fall into a state of anxiety and fear of death, while others feel calm and accept their fate. These manifestations are not simply mood changes but also signs that they are gradually preparing to say goodbye to life. The cause of this condition may stem from a decline in brain function as the body weakens, blood flow and oxygen to the brain decrease, affecting the area that controls emotions, leading to changes in perception and behavior. The awareness of impending death makes many people begin to reflect on life, relationships, and unfinished things, thereby forming complex emotions. The loneliness and disconnection from reality that comes with diminished communication skills can leave people feeling lost, leading to more silence, less talkativeness, or more brooding. In addition, biochemical changes in the body, hormonal decline, and the effects of medications can affect mood, causing anxiety or bringing a sense of relief. Some people find comfort in their faith, which helps them accept death more easily, while others may be fearful of facing the unknown. Common psychological manifestations include being quiet, less talkative, gradually decreasing the need to communicate, just sitting quietly thinking, or no longer interested in what is happening around. Some people suddenly want to talk more, share about the past as a way to rearrange their lives before leaving. Many people experience anxiety, fear when thinking about loss, worry about leaving family or unfinished things, while others feel peaceful, accepting fate, and may even give final instructions to loved ones. These psychological changes can be erratic. They can go from anxious to calm, from quiet to open in a short time, reflecting the fluctuations and emotions when they face the truth of their life. These changes can make families feel worried, confused, or heartbroken when witnessing the change of their loved one. However, instead of trying to fix or force them back to normal, the most important thing is to understand and accompany them gently. Listen and respect their feelings. If they want to talk, let them talk. If they want to be quiet, respect their space. Reassure and create a sense of security by letting them know that they are not alone, that family is always there no matter how they feel. Avoid imposing personal thoughts. Each person has a different way of facing death. Let them freely express their feelings without judging or trying to change them. If they have final wishes such as meeting someone, leaving a message, or listening to a favorite song, create conditions for them to do so. Provide spiritual support according to their beliefs. If they believe in religion or a certain spiritual value system, help them find peace through appropriate rituals or prayers. Psychological and emotional changes are not only a physical reaction but also a spiritual transformation, helping them prepare for their final journey. This is also an opportunity for loved ones to express their feelings, create meaningful moments together, and help them pass away peacefully. If you notice your loved ones showing these signs, observe, accompany them with understanding and love, because that could be their way of preparing to say goodbye to life. Fifth, decline in internal organ function. When a person enters the final stage of life due to old age or serious illness, the body gradually weakens. The internal organs no longer function as effectively as before. Signs such as difficulty breathing, heart failure, kidney failure, or changes in the excretory system are not only pathological symptoms but also reflect a harsh truth: the body is entering its last days. Decline in internal organ function is a consequence of the aging process or the progression of chronic disease. As the body gradually depletes its energy and ability to recover, vital organs such as the heart, lungs, kidneys, liver, and digestive system begin to function poorly. Causes of this process can include decreased circulation and oxygen to the organs when the heart weakens, reducing its ability to pump blood, leading to a lack of oxygen and nutrients, causing organs to gradually lose function. Toxic accumulation due to impaired kidney and liver function when toxins accumulate, disrupting the metabolic system and affecting the entire body. Impaired lung function leading to a lack of oxygen, causing shortness of breath and fatigue, causing the body to gradually become exhausted. The digestive system slows down, causing the absorption and metabolism of nutrients to decline, causing the patient to lose appetite, lose weight, and become exhausted. Electrolyte and hormone imbalances due to impaired kidney and liver function causing edema, weakness, and heart rhythm disturbances. Signs of organ failure include impaired breathing, where the patient has difficulty breathing even when resting, shortness of breath, shallow breathing or gasping for air, sometimes with short pauses in breathing, especially at night. Heart failure, with symptoms of an irregular, weaker, or abnormally fast heartbeat. Some people have signs of swelling in the legs and arms because the heart is not pumping blood effectively. Kidney failure, with signs of changes in the excretory system such as decreased urine output, dark urine, or even anuria. Liver failure, with symptoms of jaundice, yellow eyes, ascites, loss of appetite, poor digestive system function with bloating, constipation. Diarrhea or nausea due to impaired digestive function, neurological disorders when the brain lacks oxygen, causing the patient to fall into a state of drowsiness, disorientation, or coma. When the internal organs no longer function effectively, the patient falls into a state of prolonged fatigue, no longer having the strength to perform basic activities such as walking, eating, or talking. They may feel cold due to reduced circulation, lose their appetite, and gradually fall into a state of sleep more. These symptoms not only cause them physical pain but also greatly affect their spirit, causing anxiety, depression, or even making them fear that death is approaching. When signs of organ failure are detected, it is important to create conditions for the patient to feel comfortable and relieve symptoms instead of trying to prolong life with invasive interventions. Support the patient's breathing by keeping the environment well ventilated, using an oxygen concentrator if necessary to help the patient breathe easier. Control symptoms of heart failure by elevating the head when lying down, gentle massage to reduce edema, support kidney and liver function by reducing salt intake, limiting protein to reduce the burden on the kidneys, and monitoring for signs of dehydration or edema, facilitate easy eating with easily digestible, compact but energy-rich foods. To maintain health, provide emotional support by always being with the patient, talking gently, creating a quiet and warm space for them to feel secure. Organ dysfunction is a natural process when the body prepares for death. This is not only a sign of physical weakness but also a transitional stage, where the patient gradually separates from the surrounding world to enter the final journey. Family and relatives need to prepare mentally, accompany them with understanding and love, and help them have a gentle and peaceful farewell. If you notice these signs, observe, listen to the patient's body and find ways to help them reduce discomfort, because sometimes the caring care and presence of relatives are the most meaningful gifts in the last days of their lives. Dear friends, these signs do not always mean that death is near, but we should not ignore them. When we realize them, the most important thing is that we can spend time with our loved ones, helping them have a peaceful and complete last days of their lives. Let's listen to them, care for them, and take care of them with all our love. Because the most precious thing we can give in these moments is not medicine, not material things, but the presence and love from our hearts. Thank you for listening. Don't forget to like and subscribe, so we can continue sharing helpful advice together. Thank you for watching, and I'll see you in the next video.